Welcome everybody to today's seminar on sustainable development. Today we will talk about balancing research and practice at the Earth Institute. The session will be led by Ed Lloyd. Ed is the Evan M. Frankel Clinical Professor of Environmental Law here at the School of Law at Columbia University. He's also the chair of the Practice Committee, which is a standing committee of the Earth Institute faculty. So Ed will give some introductory remarks on the topic and then introduce our three speakers and also moderate the panel. Ed, please.
Thank you, Peter. Welcome. I'm, as Peter said, I'm chair of the practice committee of the Earth Institute faculty, and about 18 months ago, the faculty asked the committee to come up with guidelines for the promotion and hiring of practice-oriented scholars. As many of you may know, there are research scholars in the Earth Institute in Lamont who do a great deal of practice work, and in fact that's why we're here today, is to talk about some of the practice work that's being done in the Earth Institute. But when these scholars faced both hiring and promotion, we were concerned that the work that they do in practice is not given the credit that we would like them to have, and we wanted to make sure that they had a path within the university to advance and to expand their horizons and reach and achieve the status that others at the university do. So the practice committee over the last 18 months has worked on a set of guidelines for the appointment and promotion of practice-oriented scholars, and the Earth Institute faculty adopted these guidelines last fall. And so I'm going to do a very brief overview of the guidelines to give you an idea of what our goals are in hiring and promoting practice-oriented scholars, and then we're going to hear from three panelists about some of the practice work that's done in the Earth Institute. If I can make this work. These guidelines were put together to help the unit directors in the hiring and promotion of practice-oriented scholars. So they are guidelines. They are used by the Earth Institute Practice Committee and the Earth Institute Appointments Committee in appointments, but they are intended to help the unit directors both define positions and hire and promote practice-oriented scholars. One of the mechanisms that we do this that we use to make this happen is when we hire or promote practice-oriented scholars, we develop what are called responsibilities for these scholars, and so that there's a meeting of the minds between the scholar and the unit director about what the goals of the position are to be, what practice work the scholar will do, and how then that scholar will be evaluated both during mid-career and promotion reviews. And so these responsibilities are developed by the unit director with the help of the practice committee and are given to the scholar upon hiring to help make it clear and make the goals clear for both the scholar and for the unit. As you know, when scholars are reviewed for promotion, a committee is assembled from the unit to evaluate that work. Part of the guidelines make sure that those committees will include faculty who do practice-oriented work and are familiar with it. Another part of the guideline is that the practice-oriented scholar will create an annotated CV. The reason we call it an annotated CV is to reflect with some specificity and some detail the practice work that the scholar has done. And then the committee creates a dossier that includes the practice work. And in addition, when we collect external letters for evaluating practice-oriented scholars, we try to assure that a number of those letters have come from scholars around the country who have also done practice work, who appreciate the work of practice and understand both the goals and the constraints of doing practice work. Some of the areas where practice-oriented scholars might achieve excellence include field work, reporting in journals and conferences, but these may not be journals or conferences that are typically that a pure researcher may report in, and that's why we wanted to expand the view of what journals and conferences might be, my practice-oriented scholar might participate in. The extent of extending their own expertise, participating in outside groups, working with client groups, because practice-oriented work often has work with clients. Advancing public good, again, this is work with clients, often with NGOs, often with government. Raising and receiving funding, which is, of course, in any institution is an important aspect of work, and overall in demonstrating leadership as a principal investigator in projects. So far, we've been working more closely with Seasoned Cred and IRI. Each of those units has developed the table by which practice-oriented scholars will be evaluated and hired, and in our guidelines we attached appendices which were specifically tables for each of those units. Some of the categories that they will look at are listed here. I'm not going to go through every one of them, but to give you an idea that we've begun to work with the units. The practice committee will continue to work with these units throughout for the use of the practice guidelines to try to improve them and perfect them. So that is, I just want to give you a quick overview of that. And what we have today with today's panelists are 3 panelists who have been doing practice work in the Earth Institute for a number of years on very different topics, and we wanted to give an overview of that, and then we'll have each of our panelists will do a short presentation, and then we'll have an opportunity for questions and answers. So let me start with death by arsenic. Dr. Joe Graciano is going to talk to us about the work he's done. Dr. Graciano is a professor in the Department of Health and Health Sciences in the Mailman School of Public Health, and professor in the College of Physicians. He's done a great deal of work with metals over the years, focused a great deal of work on lead poisoning, and helped develop an oral drug to treat children with lead poisoning, and he's turned his attention recently to arsenic in Bangladesh, and that's what he's going to talk to us about today. Joe, please.
Thank you, Ed, and thank you all for being here on this fairly miserable, rainy evening. I've never considered myself a practitioner. I trained as a basic scientist, a bench scientist, but ended up eventually in the School of Public Health, and I guess everyone in public health is to some extent a practitioner. The typical model is that we get funding to research some particular disease, whether it's, discover what this disease is, this thing called HIV/AIDS, get funding from the federal government to do that, and then we're left to deal with it, to engage practitioners, to get out in the field and make a difference. And so I'm going to talk to you about a different kind of disease, a syndrome we call arsenicosis. And I can't tell you about the practice and the need for practice until I first give you a little history about the background of this problem. So this program on arsenic involves many, I think there are 15 of us at Columbia University. And how did we come together to look at this issue? Well, it all started with an article on November 10th, 1998, New York Times front page story, and the title of the story was the title of my seminar, Death by Arsenic, Wells That Pump Poison. And this led a group of us from different units of the university to come together under what was then the very beginnings of the Earth Institute, and to get involved. And we made some visits to Bangladesh, and eventually were successful in getting an NIH grant, a significant grant. It's a grant that involves 7 interrelated projects, all related to either arsenic or manganese, and sometimes both. And of these 7, and I'm not going to go into them, basically 3 or 3.5 of them take place in Bangladesh, and the others take place in the United States, where we too have an arsenic and drinking water problem. For example, one of these projects, 1.5 of them, are in New England, in Maine, and New Hampshire, where people rely largely on well water as their main source of water, and the bedrock has a source of arsenic in it. So on the one hand, there's this problem in Bangladesh and much of South Asia. On the other hand, we have the problem here too, but it's not as severe as the problem in Bangladesh. Now, this program is in its 12th year and was just renewed for another 5, we're happy to say. So we've been at this for quite some time. So let me just summarize what the service activities are, and then I'm going to talk about the health effects and the service activities themselves. We have a study that involves 24,000 adults and in turn their children. And as part of that study, we can't just study the disease, we have to help them and provide medical care for their needs. And so we have built a clinic, we have a 4-story building, we have physicians, we have dentists, we have a pharmacy, and so there's practice on that scale, caring for the people who are participants in a research study. A second component of the practice is you can't just let them keep drinking the arsenic, and this is naturally occurring arsenic. Can't let them keep drinking it. We've got to do what we can to find them a safe source of water. And so I'll talk about what we call well switching and this deep well program. And finally, it's one thing to find a source of water, but it's another to get people to drink it. You know, you can lead a horse to water. But so we have this these education programs that have turned out to be very successful, and we hope will get blown up to a broader scale. So the health effects of arsenic are many, and no organ goes unscathed, so to speak. Some of the early effects, and by that I mean after perhaps a decade of exposure, these skin lesions, and I won't show you the gory photographs. Arsenic is a class 1 carcinogen. Cancers of skin, bladder, lung, and liver, seen in many parts of the world. There are vascular conditions, and this heart attack with the exclamation point, I'm going to show you some data that's a surprise to us, in that the most substantial disease leading to death from arsenic is in fact myocardial infarction, is not the cancers. And these other conditions on the left side, some of which we have actually added to the list and weren't known until the past decade. So the problem spans across South Asia, and the history here is that when Bangladesh was liberated and became an independent nation in 1971, it had the highest rate of infant mortality in the world, secondary in large part due to diarrheal disease from drinking microbially contaminated surface water. And so UNICEF and other NGOs went in to do a good deed. They drilled wells to switch people from surface water to groundwater, not realizing that the groundwater is naturally elevated in arsenic. And so here is Bangladesh, but the problem is not unique to this country. The problem spans, at least in South Asia, and 70 countries around the world, but the lowlands of Nepal, Bihar, West Bengal, India, all the way across South Asia into Vietnam. And in fact, we have a couple of projects in Vietnam. So it's a widespread problem, but I'm going to be talking about it here in Bangladesh. So this is a map of Bangladesh, and it illustrates the color coding here is the percent of wells that are above the WHO guideline for arsenic in water. And what you see is it's this midsection of the country where the problem is. It's essentially in the delta area. This is where there's a convergence of the Ganges, the Brahmaputra. It's an area that floods, and the earth science folks who are involved in this, and many from Lamont Doherty, including Peter Schlosser here, and Brian Mayu, who's now at Barnard, have been studying the fundamental geochemistry. Why is arsenic coming off the solid phase of minerals and soils into the water? And I'm not going to touch on that at all. But we hunkered down back in 1999 in this area where the arrow is pointing to. It's an area called Narayanganj district. And if I zoom in, this is a satellite photograph of our original study region. It is 25 square kilometers. And this is the Meghna River, and what you see here are 6,000, it may not look like it, but it's 6,000 dots, each dot being a well. And we began our work by surveying every single well in this region, and you see here the color coding of the arsenic concentrations, which were measured at Lamont. And you can see, for example, up here, the wells are by and large okay with low arsenic concentrations. Over here, they're all bad. And then there are areas where there's mix of good and bad. When we went back with the results of the well tests, we labeled the wells. And in the process, I mean, this was on the one hand a survey of the wells, and on the other hand a census. And we came to learn that 70,000 people live here. And one of our objectives was to recruit originally 12,000 adults exposed to various concentrations of arsenic in drinking water, and to follow them over time. And so we recruited 12,000 people in the year 2000, and they have been seen every other year since then. And we've learned a great deal about the diseases that arsenic is associated with, and who gets the disease and who doesn't. And I don't have time, but it turns out at any given dose, some people get sick and some people don't. And maybe in the discussion we can come back to that. So we've followed these adults, and I'm going to tell you a little bit about the health effects in them. Now, one of the questions asked of the well owner on the day the well was surveyed is, how deep is your well? And this is a plot, and the credit here goes to Lex Van Keen, who cannot be here. He's traveling, but he's one of the co-directors of this seminar series. But here you see arsenic concentration across the top and depth of the well. And what you see very clearly is there is a depth below which you don't see arsenic in drinking water. And I think it's fair to say that's not a uniform depth across the country, but there is a depth in every village at which you can get low arsenic water. And so one of our strategies for intervention and for practice is to offer people access to the deep aquifer, if you will. Now, just to talk about this 12,000 person cohort. So in 2000, between 2000 and 2002, we recruited 12,000 people into this study called the Health Effects of Arsenic Longitudinal Study, or HEAL study. And they have been seen essentially every other year since then. We expanded the size of this cohort in 2006. I'm not going to talk about that, but in fact today we have 24,000 participants. But for example, the title of my talk is Death Due to Arsenic. And when you follow a group of people this large, they were 18 to 65 years of age at recruitment, they die. I mean, let's face it. And so in the first follow-up, 100 and something had died, second 120, the third one 174. So we have, by the third follow-up, we've lost 407 people. And what we've done is we've carried out an autopsy, not the surgical autopsy, if you will, but a verbal autopsy. It's a well-validated technique to ascertain the cause of death. This simply looks at all deaths by the concentration of water. So this is the probability of dying over this many days. What you see here is the low arsenic group, here's the high arsenic group. You're more likely to die if you're drinking water with arsenic, and this was published in The Lancet a year ago and a half. Now, what we've come to learn, though, that it's what is the major cause of death associated with arsenic? It's cardiovascular disease. And if we look at total cardiovascular disease, and that includes heart and stroke, okay, you see as water arsenic increases, there's sort of a trend here. But if we separate heart attack from stroke, it's not stroke, it's here. It's a rise in the risk of having a fatal heart attack. So that's sort of news, and this is after, of course, adjusting for smoking and gender and body mass index and so on and so forth. Another thing we've learned is that not only is arsenic associated with lung cancer, but it's associated with non-malignant disease. And so here, by quintile of water arsenic or by quintile of urinary arsenic, you see this increase, the relative risk of having symptoms of respiratory disease. And what do I mean by that? I mean chronic cough, shortness of breath, blood in the sputum. And these are incident cases. These are people who in 2000 had no respiratory disease. But by following them over these follow-ups, they have developed respiratory disease. And so we add this to the list of effects, and very little known about that. We've also done a lot of work with children. This little girl in our first trip in 1999, we were going around looking at skin lesions in adults, which often occur in the hands, and unsolicited, she came over and put out her hands and said, basically, I have these too, which went against the dogma that it takes 10 years to develop skin lesions. And we came to realize that there's a generation of women in Bangladesh who have been exposed to arsenic their whole lives and probably are passing it along to the baby in utero, and this work indicates that's clearly the case. 100 women, this is their mom's blood arsenic at the time of birth, and this is the baby's blood arsenic at the time of birth. They have the same blood concentration. So children are being born with, sadly, an endowment of arsenic. And this is frightening because there's work from NIH. Turns out mice don't get the cancers from arsenic. You can give them all you want. But if you give a pregnant mouse arsenic and then follow the offspring go on to develop all of the cancers. And so something happens in utero. And so it's particularly frightening that we have this generation of children now being born with arsenic, and we're worried about the consequences long term. And there's work in other countries that indicates, indeed, this is a problem. We've done a lot of work in children. I won't talk about it other than to say we've learned that arsenic is associated with impaired intelligence, impaired motor function, and altered behaviors. But let me go on to the practice side of the equation now. And so what are the options for providing people with safe water? Well, one is to use the existing wells and try to remove arsenic by various filters. We've been down that path, and some still work there, but it's not the most promising of alternatives. The one that has had significant traction is what we call well switching. And by that, here are two wells. This one, so in Bangladesh, the government screening program, testing program, I don't know if you can see, this spout is green. If it's tested and it's okay, they paint the spout green, and if it's not, painted red. This has a concentration of 5, and this has a concentration of 500 micrograms per liter. And why the difference? They're at different depths. So one strategy, particularly when you have extended families living in a group, is to encourage people to, don't use that one. I can't see what's red. Don't use that one, use this one. And we've done a lot of work along those lines. Now that strategy, here's a satellite photograph, that strategy can work, for example, in an area like this where you have red and green side by side. It won't work. You need another option when you have all the wells are bad, and we need to do something different. And this is what led us to the deep well approach. Now, how do you educate people about this? Well, the classic paradigm for health education in Bangladesh is this one. The trick is, how do you gather everybody up in a rural village? And so you tell people, gather up on Thursday, we're going to have clowns for the kids, we're going to have folk singers for the adults, and they actually parade around the village, and eventually it's this, you know, small army of people. And the clowns are, in fact, professional health educators, not just for arsenic, but this is how they deliver health education. And this clown is holding up a picture of a label that we used at the time of a child drinking a glass of water. That's our version of a green well. You put that as a marker on the well. We've also followed this up with repeatedly, because we have the wherewithal through this federal grant, to reinforce this arsenic education and other health education. We teach them about what are the diseases that are resulting from arsenic. And if you think you have anything like that, please come to our clinic, where we have, as I think I mentioned, we have physicians and dentists and a pharmacy with 65 medicines and so forth. So does this education and encouraging people to switch work? Well, our metric of success is we measure arsenic in urine every time we see these 12,000 people. And just forget the histograms, just look on the right. So here are 10,500 people who had an arsenic measured in 2000 and then two years later. And the only intervention here was education. Please switch if you have a bad well. The people who had green wells or good wells, their urinary arsenic didn't change 2 years later because we didn't ask them to change. They're staying with the same so-called good well. But the people who had a bad well, on average, their urinary arsenic dropped considerably. And if you had time to look at the histogram, you can see pretty much it's the people who had the highest who skedaddled and switched, probably because somebody in the village or family has some evidence of disease. The other approach that we focused on, as I mentioned earlier, is deep wells, providing access to deep wells. And this is that map again. We provided, we being Lex and his team, I have the privilege of speaking for the group of 15, and it is a privilege. But here we started with these 5 wells here because those folks had nothing to switch to, and counted the number of women who came, how far did they walk. We had graduate students from Dhaka University doing this, and they would actually walk home with the woman. So the circle represents sort of the distance that women are willing to walk. And eventually we expanded this program and have provided low arsenic water to not just the 12,000 people in the study, but let's face it, it's their families. So it's really 70,000 people. Does that work? Yes, it does. So here are people who had a good well, and a year or two later, their urinary arsenic hasn't changed, just as before. But here are people who had a bad well and who switched to one of these deep community wells. And you see their urinary arsenic has come down almost as low as the people who had a good well to begin with. So this is this starting area, our original area. We've expanded. This is that same area now. The squares are wells. If I shrink that up, we've expanded into this area and are about to expand into a broader area. We had a second campaign of well installations, largely related to a school-based education program, which will be my last example of practice here. So a graduate student of mine, we have a training grant, fortunately, from the so-called Fogarty Center of NIH, which is a center devoted to building capacity in the developing world. And this training grant is to train only Bangladeshi students. So we have Bangladeshi PhD students, we have Bangladeshi master students who come to the US and then go back. But this project was the idea of one of these PhD students. And his idea was, let's provide arsenic education, not only to adults, but let's go into the elementary schools. And in fact, in our study area, there are 14 elementary schools. And so what he did was he held focus groups with the teachers. They all said, yes, please, we want to know more. We only know what we read in the paper. And so 7 of the schools, the teachers got education, and a health educator worked with them to create lesson plans and so forth. And the other 7 schools didn't get the education. But all 14 got deep wells, low in arsenic. And every child in the study, and there are 1,000 children, had access to a deep well in their village. So and this is one of the schools that got the education, and here is, one of the posters related to it. So many of these schools had bad wells, and so one of our areas of focus was to install a good well, and here's the principal of the school. We have this good well being launched, so to speak. It's okay, you first. And so I drink the water, and then we celebrate. And part of the education program is art contests, arsenic art contests. And this little girl was the winner. I have her prize-winning piece. It's actually this one. It hangs in my office. And we've had these repeated, and these cover not only the 14 schools, 50 schools. And then the winner in each school comes together and have finalists and so forth. And they paint, so she's got red wells and green wells and people with skin lesions and so forth. So the preliminary findings, this has been 5, almost 6 years in the works. And the problem was getting the wells in, raising the money. NIH pays for the science, it doesn't pay for the practice. And so it's been a struggle. And the Earth Clinic provided some funds for this. But in comparison to those children who got only good wells without the education, those who got wells and education had a very substantial drop in urinary arsenic, which again is our measure of success. And I can't give you the exact number yet because the regression modeling is still going on. So let me close here, acknowledge that a large number of people are involved in this. Both at Columbia and at the University of Chicago, one of our principal investigators, Dr. Habib al-Hassan, who used to be at the Mailman School in our Department of Epidemiology, was recruited away to Chicago, and this is largely his group in Chicago, but so he's still involved subcontractually. We have terrific staff in Bangladesh, just to show you there's obviously a large number of practitioners here. And finally, I close with, so what's my role as the principal investigator? My role is to do, this is a joke, but to do what it takes. These are two of the public health scientists involved in this. And that's a staged photograph. I wasn't going anywhere. But thank you. Yes, please. So the question is, what happens once you give people low arsenic water? And sadly, the increasing weight of evidence is that even if we give, in particular the adults, low arsenic water, there's still a residual risk for cancer later in life, for cardiovascular disease later in life. We are in the midst of doing a study in children where we've given 6 to 10-year-olds access to low arsenic water and are looking to see whether some of these neurodevelopmental effects are reversible, but we don't know yet. Okay. Sure. Oh, sorry. Yeah.
Thank you, Joe. That was great. I guess one thing we don't have in the practice-oriented scholars training is training for clowns to go to Bangladesh to do health work, but we'll have to add that to the curriculum. Our next speaker is Mark Levy. Mark is an adjunct professor at Season and is deputy director of Season, and he's a political scientist working on human dimensions of global environmental change. Mark's done a great deal of work on climate security and is currently the lead author of the IPCC panel, the Intergovernmental Panel on Climate Change, and it's our hope that some governments will listen to the work that you do this time, Mark, rather than what we've had in the past. Mark also has led Season's work on the Millennium Village Project in researching climate security Mark has developed methods of protecting emergent infectious disease risk and measuring sustainable development, and is leading a project in Haiti to reduce the vulnerability for disaster risks. Mark's going to talk to us today about using climate information for decision making. Mark, welcome.
So, thank you, Ed. So, this is the title that I'm going to speak on. I think Sabina's giving the other title. I'd be happy to improvise, and no, that's fine. So I'm going to do something very different than what Joe did. I'm going to offer some reflections on the nature of interaction between scholarship and practice, and kind of try to diagnose what's wrong with the way we do it in the field of sustainable development, and identify some ways that we're doing it not so badly. I don't have any interesting photographs or maps, so I'll just get right into it. I'll say that the personal experience I'm drawing on for these reflections have to do with 3 areas of work that I've been involved in over the years. One is efforts to understand how international environmental cooperation works or doesn't work. One has to do with, as Ed said, how climate change and national security dynamics interact. And then the third one is the work that we've been doing in Haiti. I don't have any pictures, but I have 2 dumb jokes. So this was something that Daniel Bell said to me once at a dinner, and it just stuck in my head. I looked it up on the internet this morning to see if I could source it, and it's not one of those jokes that goes around. It seems like Daniel Bell really did hear it somewhere and passed it on. The only published source is an article he wrote in 1999. Just tickles my fancy, that's all. So I'm going to talk about 2 approaches to linking scholarship and practice, one that I'm calling curiosity-driven, and the other is responsibility-driven. So the curiosity-driven dynamic starts with the virtually impossible challenge that sustainable development faces when it tries to understand the world. Those of us who are trying to make sense of this are working with what you could characterize as complex coupled systems, in which one basket of those systems are human-oriented. It has to do with human agency, with institutions, with deliberate and unanticipated interventions in human systems. And the effects of those human interventions are almost completely impossible to observe. You can't observe them directly, so you struggle to make intelligent inferences about them. What kinds of policies yield better outcomes for managing environmental problems, economic problems. But putting the evidentiary chain together is really quite difficult. And the work that I was involved in, mainly in the late 80s and early 90s, around trying to understand how international institutions can either help or hinder progress on managing global environmental problems, ran into this kind of challenge over and over and over again. And typically the most ambitious studies of what makes a difference on the international political scene had the most hedged, cautious conclusions. So you had this really very unfortunate trade-off where you could only get a clear conclusion if you didn't study the problem very much, and that's very unsatisfying. And so it's normal that if you really want to dig deeper into these kinds of phenomena, that you find some way around the veil of ignorance, and often jumping into the side of practice is the only way that you can do that. You can't observe the effects directly of what's going on, and so you open the hood and you jump in. So these are a few different ways that you can think about doing this in order of ambition. The least ambitious is simply to kind of tailor what you publish to a practitioner audience and hope that it kind of reverberates back and gives you some insights into what's going on. Much more ambitious is to finagle your way in to the same rooms where the practice is taking on. So as an observer, so that you can see more immediately what's going on, and you can correct all the mistakes that you've been learning from the books and articles you've been reading. This happened over and over as I was studying the international institutions, where what the textbooks and the articles and my graduate school advisors had taught me to expect was going on turned out simply not to be going on. I remember once sitting down with the person who had written the air quality legislation in Czechoslovakia right after the Velvet Revolution. And I was talking to him to try to understand, which of the theories I had been taught were actually going on. Was it interest group politics? Was it some nature of the relationship between science and government? Was it some assessment of the severity, the impacts of air quality that influenced how these things were written? And there were no hotels at that time in Prague, so you had to stay with families, and I was able to stay with the guy who had actually written the legislation. So one night at dinner, I said, well, how did you actually do this? And he said, well, I got the German air quality legislation, and I got a German-Czech dictionary, and I simply translated it. There was none of my training had taught me to expect that kind of dynamic. It was easier to understand once I saw it in person. And then, so the most ambitious is the third, which is to design a policy and see if it works. This is sort of a corollary of Buzz Holling's observations that in complex systems that involve humans, you can never understand them adequately looking only at past performance. The complexity, the dynamics, the feedbacks are too intricate. There are no methods capable of resolving all those interactions. So if you really want to understand how these things operate, you have to deliberately perturb them and then see how they respond. And so this is the most ambitious way, that if your goal is simply to understand, you can increase your understanding by deliberately kind of monkeying with how things go on. So I would argue that in a mature discipline, you engage in these things in some degree of balance. You do the least ambitious, you do the middle, and then you've got a heavy, or a significant level of effort that's deliberately going into the fray, changing the world and observing how those changes make a difference. I would argue that at present, for the field of sustainable development, we are not balanced in this regard. We're fronted too much towards the upper level here with, you can find lots of people saying what should happen. You don't have nearly as many people actually on the front lines observing or deliberately changing. What Joe is presenting is an exception. I mean, that's a model for what we should be seeing much more frequently. This is my other dumb joke as a transition. I think, I'm sorry, these slides are not right. Houston, we have a problem. Can I try to put these look like an earlier draft of what I did. They're really, really boring slides, so I can just talk from my notes. I wanted to offer some kind of synthetic lessons from experience engaging in this kind of curiosity-driven work in the field of climate and security linkages. One is that to do this effectively, if you really want to use your entry into practice as a way of learning more about what's going on, you have to engage in long-term partnership building. These things take time to percolate and yield benefits, and simply knocking on someone's door and saying, "Can I tag along for a few days," is not quite enough. But patience does pay off, sometimes in weird ways. In the environmental security area, I entered this field by publishing a few fairly nasty articles that kind of amounted to saying, you know, you're doing it wrong. And I had a number of people tell me that I didn't understand, you know, the way politics worked, and you know, I needed to kind of go back and do my homework, and I sort of stuck to my guns, but was largely ignored for a long time. My main criticisms were that the early efforts, sorry?
Do you want to switch it?
No, I think it's okay. The arguments were not strongly rooted in the evidence. They were going way too far of the evidence, and they weren't paying attention to the way politics intermediated between environmental change and stresses. And what I found was that after about 10 years or so, there were lots of people really much more interested in resuming the debate, paying much more close attention to the evidence, and paying much more close attention to the kind of complex interactions between politics and environment. And so my lesson from that is not to deliberately distort what you say because you think you might get more traction in the world of practice. There's a story that may be apocryphal about Henry Kissinger in 1968, who was leading a study about the question, where should national security authority be vested, in the White House or the State Department? And at the time, Nixon was considering him for both Secretary of State and National Security Advisor. And so as the winds would blow from one direction or the other, he was supposedly continually revising the conclusions to his big study as to whether it should be in the White House or the State Department. Of course, he ended up being in both positions, so don't do that. Okay, this is the other dumb joke, which is the transition to the responsibility-driven form of linking scholarship and practice. Another version of this joke is, you know, be careful what you wish for. The imperative to engage in responsibility-driven scholarship comes from our roles as human moral agents. So in addition to sustainable development being a discipline about complexity, it's a discipline about what direction the world should change in. So it asks questions that are normative. You know, what future do we want? And so if you're lucky enough to ask those questions and start finding answers, then as a moral agent, you incur an obligation to try to make those things happen. It's not optional. This goes all the way back to Aristotle's view of praxis as you know, updated by many other philosophers. So you engage in practice according to this line of thinking because you must. You have no other choice. And this came through exactly in Joe's description of, you know, having identified the problem accurately. They didn't debate whether or not to try to get people clean water. It was an immediate, logical, human response to do that. So 3 types of ways you can do that. The simplest is simply publish blueprints, you know, tell people what to do. It's not very ambitious, it's not very effective. The second is a kind of partnership where you engage in maybe short-term strategic alliances with people who are good at getting things done. And the most ambitious is what I would call ownership, where you take on an ongoing responsibility to help manage an issue where your knowledge is beneficial. In the case of climate change, I would say that our research community has failed to move very far past the blueprint stage. Collectively, the balance of work that's being published on how to manage the climate change problem is more or less telling people what to do. And the exceptions to that, people who are actually engaged in practical operational alliances, are small in number, and we don't have anything at all resembling an ongoing operational commitment to kind of own an issue and manage it for generations. So it's as if we were a medical school teaching people about diseases in theory, but we didn't have a hospital to actually treat patients. So in conclusion, I wanted to draw some practical lessons from our work in Haiti along these lines. We've been working in Haiti for 3 years now, and we followed the pathway from curiosity-driven work to responsibility-driven work really fast. So the first observation is that there's a tipping point from going into the curiosity-driven exercise where you go in to the front lines because you want to understand how it works, and then you get sucked into helping to manage the problems because you feel like you have no other choice. It's a fairly big cliff to fall off of, especially when the problems that you encounter are so gigantic. So in the case of Haiti, we went from initially trying to design some principles about how you would engage a long-term project in a country like that, to implementing projects in a very small part of the country, to scaling those out to a region of a few 100,000 people, and then now trying to scale these things up to the entire country. And that's in the course of about 18 months we've gone from that life cycle. The lesson that we've learned the hard way is what I would call delusions of adequacy. We're all smart people, got high scores on our GREs, and we've been taught by Nobel laureates and MacArthur Genius Scholars. They've given us high grades, so we kind of think that we can manage any challenge. But the fact is that you can be very smart at very many things, but still fail at some basic things. And that transition from scholarship to practice is something that we're not all equally good at. And so choosing alliances effectively is really important. And the final observation is that delivering on that whole suite of responsibility-oriented practice, from blueprints to partnerships to ownership, is really, really, really hard. It should be what we're aiming for. We should be like a medical school with a functioning hospital, with a community outreach arm and so on, but we're still at the very early stages of that. I apologize for the slides being mismatched.
Thank you, Mark. You acknowledged what I guess I've feared in the practice that I do, and it's not easy to do, and so I guess it sort of re-energizes our commitment to practice, because we have a lot of work to do and a lot of training to do. Our third panelist is Dr. Sabina Marks. Sabina is the managing director and as well as a research scientist at the Center for Research and Environmental Decisions, CRED, at the university. She joined CRED in 2005 after 2 years at IRI, Institute for Climate and Society at the Earth Institute. She received her PhD in medical history from Carnegie Mellon and holds a master's in sociology and pedagogy from Cologne. She works on decision-making under uncertainty, and as an environmental lawyer, I can tell you we deal with decision-making and uncertainty all the time. So I'm really interested in hearing what you have to say, because it's something that we struggle with all the time in environmental law. Her research focuses on climate information, agriculture, public health, and disaster preparedness, and she is especially interested in the integration of climate science and social science. And I apologize, the title that she'll talk about is the one I introduced for Mark, Climate Change, Climate Information and Decision Making. Sabina.
thanks for the introduction, Ed, and thanks for inviting me to this panel to speak about using climate information for decision-making and rewards and barriers in practice-oriented scholarship. I will give a few examples of the work that is currently in progress that I'm doing that has a strong practice orientation, but will then also will move into some personal reflections on my experience, talking about some obstacles and the rewards and the outlook for practice-oriented scholarship. Okay. As Ed mentioned, I work at CRED, the Center for Research on Environmental Decisions, which is a social science-driven center, interdisciplinary, including psychology, sociology, anthropology, economics, environmental science, and policy, working very closely with the climate science community, engineering, and a wide range of disciplines represented on this campus and other campuses. So CRED came into being through two paths of research / field observations that merged. One was advances in climate prediction, in particular the IRI, El Niño La Niña forecasts. There was a strong connection between some of the founders of CRED and the IRI researchers. At the same time, there were advances in the decision sciences. And at CRED, these paths merge. So there's the assumption that the availability of information should lead to use of information. Yet people who had produced climate information, seasonal climate forecasts, found that they were not applied and used in the field. Another assumption is there wasn't enough information, an information deficit, so let's produce more information and try to produce better information. And that should lead to better decision making. Well, the answer to both of these is no. And why is that? It's frustrating for researchers to find that their work isn't absorbed and isn't turned into decision making for agriculture, public health, food security, water management, etc. So why is it? This is not a single simple path from information to decision making or behavior change. Why is that? Well, decision makers are selective when it comes to attending to information. We all evaluate our options using both our cognitive as well as our affective processes. And affect, that can just be a hint of an emotion. Do I have a positive or negative feeling about this? Or it can be a strong emotion based on experience that you had with a similar situation that is being forecasted to you. Our decisions are also influenced by the context of the decision. It makes a big difference whether I'm using information for water management or for disaster risk preparation, for a health context or for a food security context. And our decision makers are influenced by existing beliefs, worldview, cultural beliefs, religious beliefs, our goals and aspirations for where we want to be in the future, and very importantly, prior experience, which usually has associations with our affective emotional system in the brain, triggering emotions, and then we evaluate our option based on these affects that we are reminded of. So these are some of the underlying principles in decision science on which CRED bases its research, which we're trying to apply in the use of climate information and risk communication in face of environmental risk in general. So I'll go into a few project highlights. One of them where I'm trying to apply some of the insights from CRED, from the social sciences, in real-world settings using scientific information. Mark mentioned the Haiti Regeneration Initiative. I'm a small sub-project within this growing project. It's being conducted by Earth Institute in collaboration with UNEP, with the Millennium Village Project, and multiple Haitian partners on the ground. If you are interested, there's a lot of description at this website, haitiregeneration.org. We could spend 2 hours speaking about the initiative itself. So my objectives there are to improve risk communication, to support decision-making in a multi-hazard environment, to share research results with our partners, stakeholders, and local communities, but also to share these results across the multiple teams that come from so many disciplines, so that we all have a little bit of an understanding what each other do. And then ultimately to develop an early warning system for Haiti, for the South Coast, particularly one watershed, and in a first step based on hydroclimatological information for flooding. This is already very ambitious for a small sub-project as part of this initiative. So everybody knows where Haiti is. The department that we're working is in the south, and I have so far been doing my work in the Port-au-Piment watershed circled right there. Many people have seen these images of Haiti, huge erosion problems. Agriculture is taking place on like extreme slopes with very little barriers, very little protection for seeds, for small seedlings and crops. Flooding is a huge issue. This is a path that was carved by after Hurricane Hannah in 2008, not only eroding or increasing the riverbed, but taking out the entire road, which is now only passable by foot, single file, and not by car anymore. Water resources, drinking water comes either from wells, and we haven't tested for arsenic, so children, usually the girls, go and fetch water and bring it home for cooking. At the same time, another water source is the river water, which is shared by anybody who needs to go from one place to another, including cattle, donkeys. And this water is also shared for bathing by children who don't know what has been in the water upstream. This is to provide the context of what we're dealing with Haiti, just in terms of like water and climate-related issues. Of course, there are multiple other aspects, earthquake-related health risks, educational risks, energy, that are part of the initiative. So the hydrological team, led by Wade McGillis here at Columbia, has set up several climate and stream flow monitoring stations. This is one output of one of the monitoring stations, and so this is the typical information that we get. So rain events, rain accumulation in millimeter, rain accumulation in inches, soil moisture, our typical scientific outputs. Another part is water quality monitoring. These are samples that are being taken in multiple sites and being tested for contamination. Here is the result of Enterococcus levels at multiple sites, including the sites where we usually swim next to our hotel. I'll revisit that idea the next time I go. These levels are 100 times higher than the trigger or the threshold for the health department in New York to close the beaches. This is just one example. So this is a multi-hazard environment. How do we communicate this research, this information that we're gathering, to make it useful, to translate it to communities, to prepare or to be aware of the hazards that they are facing? So in order to find out, like, how can we communicate this? We're not sharing this table. We're not sharing this chart with anybody. It would be pointless. I mean, like, even within our own team, when Wade shows this chart, it's like, don't worry about it. I'm not going to go into detail. So to be effective in our communication and in the development of decision support, it requires that we do know our audience. What are their concerns and worries? Are they worried about water quality? Are they worried about flood? Are they worried about the delayed onset of rain in their planting season? What do they perceive as a risk, which may be different from what we perceive as a risk based on our scientific knowledge? We need to get their attention, and we need to translate our scientific and technical data into meaningful information, meaningful metrics. Is millimeter of rainfall, is that meaningful? Is inches rainfall? The answer is no. It's really context specific, how people measure rain. What are some of the symbols that we can use and icons that we use in our more graphic and engaging communication materials? And we need to relate to experiences to make it meaningful, and to identify and include all relevant parties through participatory processes, and not just include them once we have data that we want to share, but include them as the project is starting to develop, so they can inform our research questions, they can be a partner early on, and they don't see themselves as guinea pig of Columbia researchers coming in. They have a lot to contribute to the research development and the questions that we need to ask. Risk perception is subjective. Even though we look at probabilities and we say like the risk is such and such, these numbers are interpreted differently by different people. And these perceptions matter, and often matter more than facts. So for us, in order to understand what are people's subjective perceptions at risk, in order for our communication to fall on fertile ground, we can look at something that's called mental models, and it's like the processes of how something works, our understanding of how a scientific phenomenon works. It has been used a lot. This is an idea or a method that has been developed by Carnegie Mellon, Granger Morgan, and others, and in the context of radon in basements with regard to climate change and health-related problems. And so a mental model can be defined as representing a person's thought process of how something works, understanding of the surrounding world. It's often based on incomplete facts, past experiences, and intuition. But it does also include relevant knowledge and beliefs that help people interpret new information in order to reach conclusions, especially when hearing about risks. People refer to known related phenomena and associations from their past to decide if they find a risk threatening or manageable. And often these mental models serve as a filter for search and uptake of information. And we are all kind of like falling prey to this confirmation bias, which means we're usually looking for information that confirms what we already believe and know. So if we can identify what some of the misconceptions are, what are some of the existing pieces of information that we can insert and inject new information into, so that that people can expand this mental model. These models are plastic and malleable, but we need to provide information in a way that it can land on some fertile ground and open ears. So this is one example of where scientists were very successful in explaining the ozone layer and the hole in the ozone layer. People's understanding of the atmosphere has really been shaped by this, which now they're learning about climate change and greenhouse gases. They're using that information in order to understand, to feed it into their existing understanding. So knowing these misconceptions, this is based on an anecdotal evidence by Tony Lezerovitz at the Yale Project on Climate Change Communication, and our illustrator was able to draw this nice thing. So back to Haiti, after this little theoretical excursion. We have conducted mental model interviews. We've started. I intend to do many more. But these initial mental model interviews, it's a long process. You do a free listing task about worries and concern about people, and then you start very general questions. What is life like? And then you go deeper into when they start talking about flooding. When was the last flood? How much did you lose? What do you think caused the flood? Did you have warning? What information did you use? Who told you about it? Would you believe if someone told you a flood is coming? How do you think people know about where forecasts are coming from? So we identified a lot of these issues during these like 1 to 2 hour long interviews. Initial results from these interviews informed questions that went into a huge household survey that's currently underway. Questions about climate change perceptions, risk perception, and communication issues. So that's another set of data where we will get a large sample of information in much more like in a multiple choice kind of survey. So what have we found? Like some major concerns, actually on the slide there, you see, these are some of the community group meetings and interview that was currently going on, and these are some of the free listing tasks where people where I was writing down the things that people listed, and then we ranked them and rated them. So some of the concerns, not surprising, was flooding. We expected people to be concerned with flooding, and they were. But we weren't expecting that they were all concerned with the 2008 flood, which was this major flood. At the time I was doing these interviews, it was 3 years ago, but there was still a huge concern, even though in the meantime an earthquake had happened in Haiti, even not in this region where the region that we're working in has not been affected directly or indirectly by the earthquake. People had been reporting that they have been seeing an increase in drought. So while it sounds like a paradox, like we have flooding and drought, but like the dry season seems to last longer, and that the onset of rain coincides with the planting season. So people are concerned with the onset of the rainy season. Now, if we have a forecast that predicts averages of rainfall below normal, it doesn't tell us when. And it doesn't tell us anything about the onset. So this is a research question. Can we improve our work in terms of maybe predicting some of the onset of rainfall? Another thing, people identified this trend over the past 10 years, which was new to us. There's no climatology information really available, so we were all surprised that is there some kind of microclimate going on, and that generated a new research question: what is going on in this region? Then water quality, based on the research of the hydrological team taking water quality samples. Nobody mentioned water quality in the interviews. Only when prompted about sanitation, people were talking, we need better sanitation systems, but water quality itself was not mentioned. Maybe indirectly, the children get sick. Another thing that we didn't know about, the concern with wind was very, very strong. So usually associated with major storms, with hurricanes, but that's something also we hadn't really looked at. Surprisingly, in this region, earthquake was not a major concern, which should alert us we need to increase the communication, because this region, after the past earthquake, is probably at risk in the future. So these are some of the preliminary results from the work in Haiti, working closely with the hydrological team. Another project is a project in Chile using climate information to guide water resources and foster sustainability. This was actually cross-cutting initiative funded, seed funding that we received in collaboration. Paul Block was the main PI in collaboration with all the people mentioned there. So I was brought in as the social scientist because we have this information and we want to know if it is going to be useful. So this is the region in Chile. So Chile is divided in these 12 divisions. We were working in region 4, the Elqui River Valley, which is a semi-arid region, 100 millimeters of rain per year, which is a tenth of the rain that we get in New York. And the general objective of the project was to initiate near-term climate change decadal simulations and projections of precipitation, temperature, and stream flow. My objectives were to identify climate-related risk perception, identify water management decisions at seasonal to decadal timescales, what timescales do matter to whom, and to identify the relevant stakeholders and possible users of this information, and also to identify possibly new research questions. This is the Elqui Valley. This is Puclaro Reservoir, which you can see. Oops, sorry. You can see this is the usual level of the reservoir. It hasn't been that high in the last 5 years, if I remember correctly. Just down below the Puclaro Reservoir is a little hydropower plant. These are some of the irrigation canals, and these are the lower level irrigation canals that are springing off of the river and the reservoir. The trends have been decreasing rainfall precipitation, especially for this region of it's 50% less in the last 25 years. And here's some historical data of precipitation and stream flow. I won't go into detail, but this is generated by Paul Block and Arthur Green at IRI. And then, so that was historical data that we can share. This is seasonal to interannual climate forecasts in a tercile format. And these are some of the decadal climate projections. This is actually not for the watershed, the Elqui River Valley. This is for a site in South Africa. These projections we have not been able to generate them yet for the Elqui River Valley, but this is what they would be looking like. So we showed some of our interviewees some of this data and asked would this be useful to them. But the question is, like, we went in there, who can use this information? Who are the stakeholders? Which variables are of interest to whom and at what time scales? What are suitable presentation formats? Who should communicate the information? So it's like, who do we liaise with? There are a lot of research organizations, there are government organizations, there is a water agency. Who do we affiliate with and who then becomes our, the person who communicates with us? Whose trust do we have if you communicate with one, if you liaise with one? Does that prevent you from actually being accepted by others? So there's a lot of this institutional landscape that you need to do. Who do you want to work with? Who actually has decision authority? And then what is the capacity? What are the resources for decision making? So these are just some of the questions. So here are some of the partners that we had identified before we went there. We had a collaboration with Casalac, then with the University of La Serena, the Minister of Public Works and especially the Water Department, and then the Junta de Vigilancia in Rio Elqui, which is the water agency, a non-government agency. So these are some of the researchers and government officials with whom we met. But then we also met with a large farmer organization. It's like the farmer organization of the North. They're very interested in large-scale export, grapes for China, avocado for the world, and this is kind of like the rich man's club, huge membership fees. We met with them, very influential. But at the same time, we need to meet with the people at the Casa del Comunero, which is represents a much smaller scale farmers, such as the woman that my research assistant Elisa is interviewing there. And then there are farmers who are not represented by anybody, just on their own. And this guy has like his own well that he dug with his 5 brothers, and he has his own little irrigation system. But the well water level has dropped, so and now he can't get to the water, his pump failed. So those are like some of the issues that people deal with. And there's also actually some cattle farming. What we haven't looked into at all yet is like mining industry, huge competitor for water. All these people are going to be competing for water, how can we help? And how do we share information in a way that's actually equitable? Like, who should have access to this information? So it gets kind of like tricky what we do with this. Another project example, which is not really a project, but based on all this research that we've been doing with regard to using climate information for development, for better decision making, we have generated a lot of publications, and people have asked us, can you share this information with us, but I don't have time to read the 25 peer-reviewed papers. And a lot of, so scientists come to us, I gave this talk, and I feel like it was over the top of everybody's head, it didn't resonate, I didn't get any interesting questions. What should I do? How can I communicate better? And then practitioners, NGOs, people come to us like, I'm working with the city of so-and-so, how can I improve my communication and get people's attention? So, but it's partially by the demand that was driven, but partially also our interest in sharing our research. We have put together this guide, Psychology of Climate Change Communication, and which has been widely accepted and adopted by many people. So that's a publication. It's not a peer-reviewed journal article. It took about 3 years on and off working with a lot of people to generate this, and it doesn't show up in my citation index. I'm a co-lead author of it. It's a lot of research that's done at the center that's not actually my own research. There's some of my own research in there, but the editing for an audience, for wide ranges of audiences, takes a huge effort. Equal and maybe more than a peer-reviewed journal article. I'm not saying peer-reviewed journal articles are easy to get in. Which leads me to some of the rewards. this was very rewarding, the demand for this guide and like people requesting it, and it's now, I don't know, we had ordered another 5,000 copies to send out. Very rewarding. And you feel like you're responding to pressing problems. People have a need. People use your information. That's exciting. Like that is exciting. Requests from collaborators. International Federation of the Red Cross, USGS, Department of Defense, Department of Energy, EPA, National Geographic Society wants to adapt this guide for marine ecosystem conservation. Very rewarding. Another rewarding thing is that I have enjoyed very much is the interdisciplinary learning from working in these teams that look at practice-oriented work. It is inherently interdisciplinary. I'm learning about hydrology, climatology, public health issues, and then also teaching what I bring to the project, seeing how other people are interested in that. So there's this reciprocal relationship, which is actually very engaging. You constantly learn something new. You're stepping outside of your own field. But how do you measure success? So there must be affirmations other than the peer-reviewed publication. My work is not going to show up in Science magazine. It's not, I mean, I don't have a peer discipline anymore. I've spread in so many disciplines. I've become maybe a social science generalist. So where do I publish? What is my journal that I aim for? So it's many interdisciplinary journals that are lower on the citation index. So maybe this is rewarding. This is co-director of CRED, Elko Weber, at a 5-day retreat with the Dalai Lama. And he is holding in his hand the CRED communication guide. Very rewarding, right? But does that get me a job? So I have a job right now, which is also, I mean, depending on funding and depending on the continuation of my center. So how accepted are practice-oriented standards outside of the Earth Institute? And I'm sure some of the people that I see here, they are very worried about that. If you're a PhD student, a postdoc, and you get engaged in this practice-oriented work. Which leads me to some of the obstacles. So we haven't even managed the interdisciplinary, let alone the transdisciplinary work, and how is that accepted in academia. So practice orientation adds another complicated layer. And so who are the people who are actually those people who are connecting the disciplines in interdisciplinary work? Who are the connectors to the practice-oriented people? Does it take a certain personality, or does it also take like a person who is willing to sacrifice an academic career and will also be, that's kind of like an image that comes with you if you're practice-oriented. So who are these people? And very often it's the postdoctoral fellows or the very senior people, but what about the people in the middle, and how can they be incentivized? Once you are already a star, you have the luxury to do what you want. So, but I think these connectors are important, and we need to keep an eye on like who are they. Practice-oriented work is extremely time-consuming, and Mark mentioned some of these things about like relationship building. You can't just go to Haiti and start a project. These are long-term relationships. I worked on a project in Southern Africa where my collaborators, Steve Connor and Madeline Thompson, back when I was a postdoc at IRI, had like been for 10 years, and then there may have been like another 2-year gap when there was no interaction. Finally, they went back, and I had the opportunity to be part of the first Malaria Outlook Forum, which brought meteorological services and public health officers together to do a climate outlook planning for the next season. So this was like a 10, 12-year process until it came to fruition. And you need to build this trust. Another problem in terms of the research is standardized surveys don't work in like lab surveys, don't work in a field setting. And if it works in one field setting, it doesn't mean it works in another field setting. So how do you come up with guidelines or protocols that are easily adaptable for a context in another region? So there is no easy transfer between research locations, and every time you start a new project, it has to be a tailored approach. So time consuming on the research side, the research methods are time consuming. But then I also want to point out, like, if you want to do practice-oriented work, you better be a good manager, because you have to manage your projects at a very different level, and you need support for that. It's very heavy on administration. For instance, getting an IRB approval for a practice-oriented project. you need to have the staff that can help you do that. You need to have the staff that can set up sub-awards with non-university agencies in a developing country, or with vendors who can provide the $1 million liability insurance, because insurance doesn't exist in any form in some of the countries that we're working in. So the administrative and the management burden is huge, and I think there also have to be incentives for that. It's part of the practice. It's not just the outcomes and the cool results and like, yeah, we have maybe saved lives. It requires a huge team to actually make that happen and to work kind of like on the behind the scenes. And they need to be rewarded too for their work. I don't think I need to say this, but funding sources are hard enough to get for strict disciplinary scientific academic work, but who funds the practice? I mean, like, we may get initial funding for the project, but who funds development? NSF doesn't fund development. So those are really important. Those have been obstacles, and they make you wonder, where do I want to go with my career? So this is a very incomplete chart, but I think sustainable development has always, it started to be like multidisciplinary teams were able to get a little bit into sustainable development, but it was just people from multiple disciplines not really interested in each other's discipline, doing their own thing. They were only doing their own thing within a project. Then we moved towards interdisciplinary, I think, which achieved more towards sustainable development, gets us a little more into the sustainable development practice circle. Then transcending disciplines and transcending university boundaries, I think we're a little closer. And then the practice-oriented work, I think is very suitable for sustainable development, but I don't think it's the ultimate goal yet. So, like, or the ultimate method. I think we need to continue to work towards methods and processes that are suitable for sustainable development. I think we constantly need to reflect: is what we're doing is practice oriented now our end goal, or what is the next step? So that's kind of like a question I would like to end with, because I didn't want to end with all the obstacles that I had on the last slide. So that's my experience.
Thank you, Sabina. Now we'll open the proceeding up to questions from the audience, if there are some. Anybody have questions for any of the panelists?
What is the quality or qualities of the water levels of the water in Chile, please? Is there good quality of water in Chile?
In where?
In Chile.
In Chile. We didn't do water quality analysis in Chile. Potable water comes mostly from groundwater, which is different from the river water. And in the region where I was, there was no alerts or no advisory that we should not drink the water. But I'm not basing this on evidence. We didn't do water sampling for potable water. We were interested in water for irrigation, mostly for irrigation for farming, which comes from the river water. And basically the river is glacier fed, precipitation fed.
You were satisfied with the quality?
I didn't get sick, if you're asking that. So, but we didn't test potable water. It wasn't part of the study at this point. Right.
Here, Walter Bedgen from the IRI in the Earth Institute. I have a couple of comments, and I would like to get the reaction of the members of the panel. As you know, in the IRI, we have been working in this interface of research and practice. And one of the lessons that at least I learned is that scientists, especially bio-geoscientists, are used to move in their own communities, right? And so, the prizes, the rewards are good publications, prestige, etc. Then suddenly they start working closer to practice, and the work now starts affecting the lives of real people. A small town in Africa. And that is extremely rewarding. Now, again, in my experience, although that creates a lot of will to continue working, that path is extremely ineffective and inefficient. It's rewarding for the research who believes it's advancing in practice, but it's extremely ineffective. And usually it's extremely ineffective because, let's take the agricultural sector. Your end user is going to be a farmer. And that farmer has already a trust developed, for example, with an extension worker from an NGO. He already developed that. This guy knows his family, he knows his interests, he's been working with this farmer for a long time. Then this extension worker is probably interacting with an applied research group, maybe a university or a national research organization. And these guys are working with people that are doing more basic research. So you have a chain, already established chain of information. And although it's extremely tempting to go all the way to the end user from Columbia University, it makes a lot more sense to understand that chain, to see what can it be done to strengthen each one of the links, maybe help to establish links that are missing. And I think that, at least, again, in my experience, that helps a lot to achieve this balance that is the subject of this meeting. Is you don't really need to do from Columbia University a lot of the practice all the way to the end user. It probably makes a lot more sense to map these chains and know where your contributions are more effective. And therefore, you can still do a lot of very good research if you approach the problem from this way. Thank you.
I'm going to respond first to this. I think that was, for instance, the project in Chile, trying to map the institutional landscape that plays a role in water management. So if we find that Casalac is the trusted institution that also reaches out to the smaller farmer communities and to the junta, to the government and everybody, then that may be our point of entry, and we don't need to talk to everybody, to every small-scale farmer. But Casalac may actually rarely talk to these small-scale farmers so that we can contribute to their knowledge as well. If we find that there's conflict or competition between these institutions, I think that is something that, we're not going in as facilitators. I don't think that's, ideally we would, but that's not our training. But we can point out better ways for them to communicate with each other. So, I'm not saying that that everybody in the chain needs to be a contact person for us, but you need to map it first in order to identify where can we work most effectively and most efficiently, and that person needs to be identified. And you need to hear from the small-scale farmers what they see as their representative, so that they are covered, because they may have very different perspective. You get more of a real picture. But I agree, if you don't want to completely waste your time, identify your best entry point where you get the greatest outcome for your effort, so that you're providing information that others can then share. We also don't want to continue to be in the country for the next 20 years in Chile, but provide capacity that they can then spread.
I think you've identified one proposition for how scholarship can engage practice most effectively, but in my view, we don't yet know the answer to the question. And the odds are that there's a lot of contingencies that matter. Some strategies are going to work best in some settings and some in others. And in some cases, you may have to go all the way to the end directly. In other cases, you might be able to perturb the system and make it work more effectively. But I think our knowledge base is still rather weak on this.
Hi, I want to thank the entire panel. It was very interesting. I have a concrete question for Sabina, and it overlaps, I think, with a bit of what Mark Levy has addressed about ownership being the end goal within sustainable development. My question to Sabina is, when you were discussing the mental models, and in Haiti, people didn't see water quality or the earthquake, as important, and the same can be said about Southern Africa from my experience. People don't see HIV or AIDS as important as malaria or TB. How do you construct, where is the leadership in the ownership policy that you construct? Do you then just construct a mental model that will work for Haiti, that will be different from the mental model that you present to the IRI or the US institutions for funding? How do you prioritize, and how do you set that? Because there are different audiences. How do you bridge the differences between them? And then just the general question, what kind of leadership in ownership do you see? Is it still, is it equitable? Is it fair? Because this information or the knowledge and communication is more on the one side than on the other.
So, with regard to like how do we bring water quality like higher up on the priority list if we think it is important, I think from what we're still in the process of identifying, if flooding plays such a big role in people's minds, I think we have to start working with people on flooding, and then in relation, we can then show how flooding might be related to water quality issues, or how drought can relate to water quality issues. Because like if you have like stagnant water, it doesn't have a lot of flushing out. You may have just as much of a water quality problem as if you have flooding and contamination from non-existing sanitary sites, or so washing off of bacteria and fecal matter into the river that previously was in a dry zone. So I think like if drought and flood are huge worries, we're trying to link, I would propose to try to link water quality to that, instead of trying to impose water quality is a big issue. The other thing with water quality is if I drink that water, I will get sick. Everybody there told me, oh, you can drink the water, we drink it. But I would get sick, and we have to tell us, like, we're the weak ones, we can't, like, and we have to apologize. It's kind of like you're being offered the water, and you have to find a way to say that you can't drink it. So people don't perceive it as a risk because they don't have acute illnesses from drinking the water, but the long-term consequences of exposure to high levels of particles of bacteria can have aspects, and Joe can probably talk more about what some of the chronic problems might be. So we have to start to identify those. But I wouldn't like try to, so tying the high priority items in with the low priority items and connecting those factors, I think that would make sense.
Just to say that those who don't perceive the risk are the survivors.
Good point.
Are they the risk takers? Other questions?
Hi, Barbara Platzer at CRED. I had a question, given that the title of this is Balancing Research and Practice at the Earth Institute. So to the panelists, imagine you were in a room with Peter Schlosser and Jeff Sachs and Mike Purdy, and you had to highlight some really key specific recommendations on how to make life easier as a researcher. If you're a practice-oriented researcher.
Get rid of the general counsel's office.
It's always the lawyers that are the problem.
I mean, you alluded to the problem of having insurance, but seriously, working at this level, there was a time, I've been at Columbia for 35 years, there was a time when you can be an entrepreneur and go out and work and do what you wanted, and there wasn't the concern for liability. There wasn't the concern that, we don't want to be on the front page of the New York Times in a bad way. So that over time, the number of obstacles that have arisen, probably justifiably so. I mean, the trustees of this university have seen, the School of Public Health is out there in 102 countries. And are we abiding by policies that are in place? Tax withholding is the latest one to hit. Are we complying with tax withholding laws. And so there's another layer and another layer. And so I've spent an extraordinary amount of time with yet another level of complexity coming from the General Counsel's office. Of course, we need them. I'm being facetious when I say it, but that has been the well drilling, for example. When we started the first 5 wells, we engaged well drillers in Bangladesh. The word got out. I don't know how. It was mentioned at a seminar. Went back to the General Counsel's office. Stop what you're doing. Colombia does not want to be looked at as owning a well because something might go wrong. And it took us a couple of years. We had to engage. We did engage a wonderful NGO, Water Aid, which is an international, it's based in the UK, but we had to set up contractual relationships with them, and they in turn had to set up a process where when they installed a well, there was a formal exchange eventually after villagers were trained to maintain the well. The government had to come. There's a signing process. 12 villagers sign and say, we have been taught to maintain this well. The Water Aid signs and says, we hereby turn this over to this village. And the local government official signs and says, I've witnessed this. So that took years to negotiate. And I know we're not alone with the legal issues. Is that sort of what you expected? Or?
Well, so I'm an 8-year employee of Columbia, and I've witnessed some of the complexities, but I think we need to be better about communicating what it is we need from Columbia and EI leadership if we're serious about practice-oriented research. So I think that tells a story, and an admirable story, of a good fight that hopefully was won in the end, but we need specific, clear messages to university leadership, EI leadership, and then to our funders. And I think we need to be more serious about that. And so I'm hoping the 2 other panelists maybe will be able to follow up and give some specific ideas.
One thing is Dave Kranz, one of our co-directors at CRED, when we were hiring new program coordinator and a new assistant director, which Barbara is one of them, we had candidates who were pure administrators, excellent records, but no idea about the work that we're doing. And they insisted, for good reason, and I agree, but he said, we want administrators who understand our work and who will facilitate the work and who will not obstruct this work. So we want people who care about this work. We don't want people who they don't care if they're working in public health or environment or biochemistry or some engineering problem. People who just want a job in administration. We want people who understand the processes, who will then engage in a very different way trying to make it happen. And I think we have always been successful having people who, we're hiring people who also attend the research seminars and who are part of the team and who contribute to that. So, I don't know, can we take administrators from Studebaker to the field with us? Or can they come to our seminars so they start to care and they're not following just blindly the rules? This is probably very unrealistic to take, but I think the fundraising office does a lot of traveling to the sites and to help identify what are appropriate funders for this field. They are informed. Can we extend something like that to some of the higher administration? Another way to do is we can just continue hiring more staff who helps us with the increase in regulations, and many people are agreeing that the regulations have increased due to funders, due to lawsuits, etc. But would we then just accept that this is the situation and we just throw more staff at it and hopefully that will help? I would like to see that the university learns more about what we do. That's someone who has maybe not been at Columbia long enough.
Let me just make, go ahead, Mark, then.
Just two very brief things. The first is that compared to other universities in the U.S., and even more so compared to the rest of the world, we do a really, really good job at this. If you talk to people at other places, you can see how bad it is in many other areas. There are a handful of insights into how organizations change and innovate. And Columbia's largely doing the right kind of thing, setting high-level strategic priority to do this thing. You know, practice is valued. The reforms that Ed mentioned, these are not taking place in other areas, and these do make a difference over time. I would just the second point is just to reinforce what Joe said, and I guess to generalize that, I would say, right now, when you want to do this kind of thing on a big scale, you think something up, you go to a bunch of administrators, and they say, no, 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 no. And then it iterates over and over and over until finally you hit on something that will get through. And I think we need the upside-down version of that, where we have offices at the university that are inventing the things that will work in general, you know, new forms of institutions that we can deploy. We don't currently have that.
Well, I do believe there has been a committee established by Lee Bollinger. I know that Wafa El Sadr at the School of Public Health is involved as chair or co-chair, trying to collect what are the problems with this research going on globally, and how can we deal with them. I do think there's an initiative there.
Reinforces my first point.
Let me just make a quick comment in terms of where the emphasis from the EI in general is. And it is expressed in our mission, in all our organizational charts, that practice has an equal role next to research and education, because we recognize that you cannot practice sustainable development as an academic field or discipline if you are not giving practice a space. Nevertheless, we also know that in traditional academic structures, this is not typical, and that we have to fight against structures that have been built over hundreds of years. So that sometimes is a tough battle. Nevertheless, we have made that as one of our core goals, and we have put measures in place. Ed talked about the appointments procedures. There are other things in terms of trying to allocate funding so that these projects can go ahead. You know that the Millennium Village project that Jeff Sachs is leading has a big footprint and is deeply rooted in practice. I mean, that's actually where it's coming from. So the final piece that we need to work on, and that's pretty hard to penetrate, is the awards, promotion, and recognition system of academia as a whole, not just Columbia as a big university, research university. And I think there is some progress on that front too, but for my taste, it's going too slowly. Nevertheless, I think we just have to keep working on that and have to use all venues that we can to move that forward in tangible terms. And I think we are all deeply committed to that, to take it up within the university, but also beyond Columbia in our professional associations and in the global context in alliances with other universities.
Just to add what my colleagues said, I mean, I think we are trying through the practice committee and through the EI in general to address these issues. And I think what has been said is right. I wish there were models. We look for models around the country and around the world. We don't find them. So in some ways, we're on the cutting edge of this issue as well. But at least speaking for myself, if there are obstacles that you're seeing that we're not seeing, I'd be certainly happy to talk to you about them and take them up at the practice committee if that's the appropriate place. There may be other committees in the university that are more appropriate. But thank you for the question. Other questions? Okay, well, please then join me in thanking the panelists for sharing their thoughts and their experiences with us today. Thank you.